Ever gotten a hospital bill that made you check twice to see if they accidentally charged you for a yacht? That $18 aspirin, the $3,000 facility fee for sitting in a room. It's enough to make you wonder what's really going on. Today we're pulling back the curtain on why your hospital bill looks less like an invoice and more like a ransom note. Buckle up. The hidden markup game. Let's start with the star of our show, the Charge Master. Sounds like a villain from a budget superhero movie, right? Well, it kind of is. The Charge Master is essentially the hospital's price list, a massive database containing thousands of procedures, medications, and services, each with a price tag attached. And here's the kicker. Those prices are completely made up. Hospitals don't calculate the actual cost of providing a service and add a reasonable profit margin. They start with a number, often multiple times higher than the actual cost, and that becomes the list price. Why? Because in the bizarre world of hospital billing, nobody actually expects to pay list price. It's like those furniture stores that are perpetually having a 70% off sale. The original price is inflated, so the discount looks impressive. That saline solution dripping into your IV? It costs the hospital maybe $1, but on the Charge Master, it might be listed at $500. That Band-Aid? 50 cents to them, $25 to you. The reasoning follows a twisted logic. Insurance companies negotiate discounts, so hospitals jack up the prices to compensate. It's an arms race of numbers, and you're caught in the crossfire. The real tragedy? The people who actually pay these inflated prices are often the ones who can least afford it, the uninsured and underinsured. Insurance companies negotiate those prices down to something closer to reality. But if you're uninsured, you're stuck with the fantasy prices that nobody else pays. The liability factor, just-in-case medicine. Now let's talk about why your emergency room visit for a twisted ankle included a CT scan, blood work, an EKG, and consultations with multiple specialists. Welcome to defensive medicine, where doctors order tests not necessarily because you need them, but because what if you do and they didn't order them? Doctors live in fear of lawsuits. Medical malpractice suits are expensive, career-damaging, and emotionally draining. So physicians practice what's called defensive medicine, ordering extra tests, procedures, and consultations to cover all the bases, even remote ones. Got a headache? Better get an MRI just in case it's a brain tumor. Sprained your wrist? Let's x-ray everything. Is it overkill? Often yes, but from the doctor's perspective, it's risk management. One missed diagnosis could mean a multi-million-dollar lawsuit. So they order the test. And who pays? You do, through higher bills. The irony is thick. We're paying enormous amounts for unnecessary procedures because doctors are avoiding the enormous costs of lawsuits. It's a vicious cycle fueled by fear, adding an estimated $45 to $200 billion to healthcare costs annually. Insurance, the discount illusion. Here's where things get truly surreal. Remember those fantasy prices on the Charge Master? Insurance companies don't pay those. They have negotiated rates, the real prices that are usually 50 to 80% lower than what's on the bill. This sounds like a good thing, and for insured patients, it kind of is, but it creates some perverse incentives. Think about it. If you're a hospital and you know insurance will only pay 30% of what you bill, what do? You increase your prices so that 30% is still profitable. It's like when you're haggling at a market, you start high because you know the buyer will negotiate down. Except in this case, the market is your health, and the stakes are slightly higher than a hand-woven rug. This creates what economists call a two-tier pricing system. Insured patients get the negotiated rate. Uninsured patients get walloped with the full Charge Master price. It's the same service, the same doctors, the same building, but wildly different prices depending on whether you have insurance. It would be like going to a restaurant where the person with a membership card pays $15 for a burger, and you pay $60 for the exact same burger. Absurd, right? But wait, there's more? Insurance companies also employ armies of people whose entire job is to find reasons to deny claims. Prior authorizations, medical necessity reviews, out-of-network surprise bills. It's a bureaucratic obstacle course designed to reduce the amount insurance actually has to pay. And guess who often gets stuck with the bill when insurance denies coverage? That's right, you. The administrative monster. If you think the medical side of hospitals is complicated, wait until you meet the administrative side. For every doctor treating patients, there are roughly 10 administrative staff members shuffling papers, processing claims, and arguing with insurance companies. The United States spends more on healthcare administration than most countries spend on healthcare total. We're talking about $1 trillion annually just on paperwork and billing. That's roughly a quarter of all healthcare spending going to people who never touch a patient. Why is it so complicated? Because every insurance company has different rules, different forms, and different billing codes. A hospital might deal with dozens of different insurance companies, each with its own special requirements. Someone has to keep track of all that, translate medical care into billing codes, submit claims, follow up on denials, and resubmit when the insurance company loses the paperwork. This creates a bizarre situation where you need a bachelor's degree just to understand your explanation of benefits. You'll see things like billed, $2,000, allowed, $600, plan paid, $400, you owe $200, but also we're sending this to collections for $1,800. And here's the kicker. All this administrative complexity doesn't improve patient care one bit. It's pure overhead, money that could have gone to hiring more nurses, buying better equipment, or lowering costs. The real victims, patients. At the center of this financial tornado are patients, real people facing real medical problems, now with the bonus stress of potential bankruptcy. Medical debt is the leading cause of personal bankruptcy in the United States. Think about that. People get sick, get treated, and then lose their homes, their savings, and their financial futures. It's a uniquely American nightmare. The stories are heartbreaking and infuriating. Parents who skip their own medications to afford their children's. Seniors who cut pills in half to make them last longer. Cancer patients who delay treatment because they're terrified of the bills. People who call Ubers instead of ambulances because they know that ambulance ride will cost them $3,000. And the cruelest part? The surprise bills. You do everything right. You check that your hospital is in network, you verify your doctor participates in your insurance plan. And then you get a bill for $50,000 because the anesthesiologist was out of network, or the pathologist, or the radiologist reading your x-ray from another state. You didn't choose these providers. You probably never even met them. But congratulations, you're now in debt. The psychological toll is immense. People are making impossible decisions. Do I get this surgery or keep my house? Do I take my kid to the ER or hope this fever breaks on its own? Healthcare shouldn't come with these kinds of Sophie's choices, yet here we are. How it got this way and what you can do. So how did we end up in this mess? Healthcare costs have been rising faster than inflation since the 1960s. Insurance companies grew more powerful. Hospitals consolidated, reducing competition. Malpractice fears pushed defensive medicine. Administrative complexity exploded. And through it all, there was no real mechanism to control costs. When you're sick, you can't shop around like you would for a TV. You don't have time to compare prices. You don't have the expertise to judge quality, and you're often making decisions under duress. The market mechanisms that normally keep prices in check just don't work in healthcare. But here's the good news. You're not completely powerless. Here's what you can do. Always ask for an itemized bill. That $2,000 miscellaneous charge might disappear when they have to justify it line by line. Negotiate. Yes, really. Hospital bills are often negotiable, especially if you're uninsured or paying out of pocket. Ask for the cash price or the Medicare rate. Check for errors. Studies show that up to 80% of medical bills contain mistakes. Look for duplicate charges and services you didn't receive. Use tools and advocates. There are now services and apps that help you decode medical bills and negotiate on your behalf. Don't ignore the bills, but don't panic either. Medical debt is treated differently than other debt. Hospitals are often willing to set up payment plans or reduce charges for financial hardship. Support systemic change. This problem won't be solved by individual action alone. Support transparency in pricing and advocate for healthcare policies that prioritize patients over profits. The next time you see a hospital bill, remember, it's not about what it costs to treat you. It's about what they can charge. Understanding why helps you become a more informed patient and a better advocate for yourself. If you learned something new today, Hit that like button, subscribe for more deep dives, and share this video with someone who's been shocked by a hospital bill. Stay healthy, stay informed, and maybe keep some aspirin at home. The hospital's $18 version isn't any better.